And of course, the other, at least another uncertainty, really sort of on top of that, is that we have the quote Obama plan, and right now it looks like we're not going to opt in to those two offerings from the Obama plan, which includes the Medicaid. Do you have any opinion about that, or?
Yeah, I mean, I'll give you my thoughts on it. The Affordable Care Act, sometimes called Obamacare.
By President Obama, by the way, yeah.
By President Obama. So I think it's okay to call it Obamacare.
Sure.
I was and am not a fan of Obamacare because I don't think that it deals with the most difficult, compelling problem in healthcare today, and that's cost. It doesn't do anything about cost, and that's our real problem. So I mean, I'll tell you my bias up front. I was not a supporter of the legislation. Having said that, there is a provision that would allow the state, all states, but Louisiana is what we're talking about, to add 400,000 people to the Medicaid rolls, and the federal government would pick up most of the tab. Normally, we would have to pay a third of it. In this case, the Fed's going to pay almost all of it. The governor has decided not to do that. Whether you agree with his decision or don't agree with it, if you read the business plan for the new charity hospital in New Orleans, it assumes that we will be a part of the Medicaid portion of Obamacare. And if we're not going to be a part of it, then the numbers, the cash flow analysis for the new hospital, I can tell you, doesn't work. I mean, that's just a fact. Whether you like Obamacare or don't like it, they built a new hospital on the premise that we would be a part of it. Now, what will happen in the future, I don't know. I don't know what the role, any factors in this regard will be in terms of Children's and Turo's decision, but I've read the business plan more times than I care to remember, and I will tell you it assumes, it basically says if we do not join the Medicaid portion of Obamacare, this new hospital will go bankrupt. Now, that's what it says, whether you agree or disagree, and that's why I've always said we need to be careful here in building something that's too large that won't be able to cash flow.
That's really amazing. Now, that deals with just that one building. We also have the situation where you mentioned, I think, how many hundreds of thousands of people are not going to be covered by
about according to the Kaiser Foundation, which
is a recent report, by the way. Am I correct?
Right. They are estimating roughly 400,000 people in Louisiana today who don't have health insurance. If we had elected to become a part of the Medicaid portion of Obamacare, would be added to the Medicaid rolls. The feds would pay 100% until 2016, and then after 2016, the feds would pay at least 90%.
Right.
Now, now the governor, I think, has chosen not to join the Medicaid portion, and he is working on a plan to provide health care to these 400,000 that won't be on Medicaid, but we haven't seen the details of the plan yet, so it's hard to comment on it.
Yeah. Well, that being the case, if we don't know where the money's coming from, I mean, obviously certain, the federal government under the Obamacare portion that we are not opting into, but the government is going to, the federal government, I should say, is going to create its own plan for Louisiana, as well as the other, I think, 12 states or 13 states that have opted out of. So we are going to have, obviously, some money coming in for Medicaid, but we're just not sure. I mean, and plus,
not new money. We have about 800,000 uninsured people in Louisiana. They don't have Medicaid. They don't have Medicare. They don't have any private insurance. my understanding is that about under the Obamacare, half of those were going to be placed into Medicaid, and the other half were going to be able to allowed to buy insurance on the insurance exchange, and those purchases were going to be subsidized by the federal government. Now, the insurance exchange will continue on. That's not voluntary on behalf of the states, but Louisiana's made a decision not to join the Medicaid portion of Obamacare, and the governor's going to come up with a plan of his own, I'm told, to provide health care to those people. Now, how we'll pay for it, what the details are, I don't have any of that information. I don't think anybody else does yet.
Will the legislature have any input at all? Do you know?
I do not know. The legislature, to my knowledge, has had virtually no input in any of this so far. Will they have more input in the future? I don't know.
Sure.
I have no way of knowing unless they. Well, I just don't know.
I think we're all speculating then. So.